A very good afternoon, Vanakkam and Namaskar to all in the audience. I am here to present the paper by the benevolence and the responsibility produced by me, by our Master of Masters, Dr. Shanmugam. And for the want of time, there are a large number of papers are to be presented. I skip over the initial credentials. I dive directly into the paper. Like all branches of medicine, India has also contributed many medical systems also. Among the many medical systems, the medical system of Tamils, the Siddha medicine, has the great tradition and very good scientific basis to be presented all over the world. The Siddha system of medicine has such a great tradition that it is not yet fully understood even by Tamil people. Because of that, and to present the whole picture of the Siddha medicine, I give a brief history about Siddha medicine first, and then I will dwell upon the specialties of Siddha medicine in the later part of the paper. Sangam literature, which has a history of 2000 years, has many evidences of an established Tamil medical system. This medical system is not told as Siddha medicine or any other medicine, but it is told as just as Marundu or Maruthuvam, because there are no other medical systems by that time in Tamil Nadu to compare that with that. So it was just known as Marundu or Maruthuvam. The importance of this Marundu or Maruthuvam is this Tamil medical system had its own philosophical basis and medical practices that is not seen in anywhere else by that time or even by this time. This Tamil medical system got added by the Jain influence, which was around the 2nd to 5th century AD. Few Jain philosophical elements were added to that existing Tamil medical system, and this medical system is called as Amanar Maruthuvam. This Amanar Maruthuvam is a very special word. It is not very widely known. This word is present only in very few Varmam medical texts only. So the Amanar means summoner, that is Jains. The Jains practice that medicine. Why they practice this medicine is they needed this for some philosophical reason. The problem with this Amanar Maruthuvam is this introduced some number of Sanskrit terms also in the existing Tamil medicine. Even just before that, the Tamil medicine had only Tamil terms for philosophy, medicines and everything else. But at the time of Jain influence, a few Sanskrit words are included in this Tamil medicine, and it then became Amanar Maruthuvam. The reason why the Jains practiced the medicine is they needed this for their 4 dhanas. The Jain religion gave importance to 4 dhanas, that is Annadana, Aushadadana, Adaikaladana and Jnanadana. This is the 4 pillars of the Jainism. In fact, the Digambar Jains, which were not allowed to wear anything, they are not allowed to have any possessions at that time, but they were allowed only to have medical manuscripts in their hand. This gives the importance of the medical systems they practiced. Influence of Sanskrit grew in the next phase of Siddha medicine, that is the Pallava and later Chola periods, the periods between the 5th century to 12th century. In that time, the influence of Sanskrit grew. In fact, Sanskrit was the court language of the Pallavas. So, naturally, influence of the Sanskrit grew. Because of that, more Sanskrit words were introduced into Tamil medicine texts, and they became part of the philosophical elements, raw drugs and compound drugs. Everywhere, the influence of Sanskrit grew. Despite that, the originality of the Tamil medicines were maintained even in the drugs. And in the period, the influence of Jainism was gradually reduced, and the so-called Saivite revolution started. The Saivite revolution absorbed the medical system already existed in the Tamil medical system and Amanar Maruthuvam, and added some more Saivite philosophical elements into it. And it was Tirumular who first started using the word Siddhar and Siddha Maruthuvam. Tirumular was at the time of 5th to 6th century AD. He was the first one to use the word Siddhar or Siddha Maruthuvam later. Up to now, we have no textual references in the period before this, because it continued as a nigranda or oral tradition. Everything was passed orally and nothing was written in the textually. So we don't have any medical books for the period. But we do have references, the existence of the Tamil medical system before that. We come to that part later. And in the due course of this medical system became to be called as Siddha medical system. In the Siddha medical tradition, it was Sivavakiyar who started to have a separate book, who wrote the separate book about the Siddha principles. And after that, a large number of Siddhas have come and written a large number of books. Now we have thousands of Siddha medical texts. All of them can be grouped into two classes, a Kaya Siddha tradition and Jnana Siddha tradition. Kaya Siddha tradition is giving medicines to diseases, and Jnana Siddha tradition is using Varmam, Yogam and other things without using much medicines in the other tradition. Now we have traditions in both type of, we have large number of medical works in both type of traditions. Right now, before we dwell upon the evidences and other things, we should keep two important things into mind. The first thing is, the tradition of Siddha medicine is more than 2000 years old, even though the word Siddha was first used by Tirumular, and even though the text, the word Siddha medicine was started to be much later. The tradition of Siddha medicine is more than 2000 years old. The second important thing is, the Siddha medicine system has a history and tradition of more than at least 2000 years. And the age of Siddha medicine is the age of Tamil language itself. This is a very important point we should bear in mind. Now we go into the evidences of Siddha medicine. Siddha medicine, in the later part of the paper, I am limiting to 4 important points. The first point is, Siddha medicine is the first and foremost Indian system of medicine. The second point is, it has deep scientific basis. And the third point is, it is a complete and independent medical system. And the fourth point is, it is a medical system for the future. I will go one by one into all these topics. The first Siddha system is the first and foremost system of medicine. Subramaniam Malayandi, an epigrapher par excellence, in a very important paper called Epigraphical and Cave Painting Evidences, gives strong evidences which prove Siddha is much older than what many people think. It may be 2000 years old even by Sangam literature itself. Sangam literature is 2000 year old, and Subramaniam Malayandi puts Siddha medicine might have been 2000 year olds by that time itself. I have given the references and the link of that paper in the text. My paper is on the souvenir given to you on page number 183 to 195, and page number 195, this point is there. And in the Sangam literature itself, there are large number of evidences. Use of many medicinal plants such as neem, mustard, amla fruit, and I have given whichever the books, the references are given in the within the brackets. Neem and mustard in Tolkappiyam, amla fruit in Purananur. And if you think that's a medical system, there are surgical methods also. A suture needle has been described in Paditripathu, and treatment for war wounds has been explained in Sivakasindamani. And if you think the physicians are one here and one there, there are many or even hundreds. Physicians are named Noi Marunda Aringer in Tolkappiyam, Marunda Aindu Kodutha Aravon in Natrinai, and more importantly, the word Nulor is very important. Tirukural says Nulor. It itself means there are many the doctors, not one, not two, not three. There are many doctors were there, physicians were there in the Tamil medical system. And if you think there are no lady doctors, in the Sanskrit I don't know much lady doctors are there in the text, but we have lady doctor has quoted in the Manimeghala itself called Maruthuvi. Manimeghala herself is called as Maruthuvi. And there is a note of a maternity home in Korundagai, and doctors helpers are known as Marandalar and Ulaichhalvor in Paditripathu and Tirukural. Presence of a government hospital has been told in Silappadigaram as Nedungal Mandram. Many medical villages which exclusively devoted to medicine has been there, there are quotations about at least 8 villages in all the Sangam literature. And poets and singers who happen to be doctors have the prefix of Maruthuvan. We have notes about Maruthuvan Damodarnar and Maruthuvan Nallachudanar. And many poets are named by the medicinal plants himself. There are 7 of them. One of them is Kavatanar, who was named after Kavatambu. And not only in the masses we had medicinal physicians, they were also in the royal court. In Aimberangulu, in Enbarayam, which were the part of the royal court, physicians were there. This large number of evidences prove the presence of a full-fledged medical system even before 2000 years. And this medical system, not only in the society, but also in the homes. Home medicinal plant gardens have been quoted in Palamoni Nanuru, verse 353. Ethic for a physician must share all his knowledge and should not hide that with himself. Excerpts Paditripathu. Ashtama Siddhi like practice. Please note the word Ashtama Siddhi was not there. The Ashtama Siddhi like practice, hiding, flying, hiding into the, hiding away from the sight. This type of practice has been told in Kurundogai. And many words for medicine are present in Tirukural and Pingalanigandu. And there are even books named in medicinal names, Yeladi, Tirikadagam and Sirupanchamulam. And the next period, epigraphical references in the Pallava and Pandya and later Chola periods. In the Pallava period, there are a few epigraphs. Tax for medicines, tax for raising medicinal plants, and sometimes tax-free lands given for a physician. In the Pandya period, physicians were named in the Pandya court. Their names are seen in epigraphs. But the most important epigraphs are present in the golden periods of the epigraphical era, that is the era of the later Cholas. There are more than 50 epigraphical evidences, and the most important being the Tirumukural epigraph. This is the world's longest epigraph. This is 640 feet long. It is present in a village called Tirumukudal in Chengalpattu district. And it explains about a hospital, a doctor there, a surgeon there, and 2 people for preparing medicines were there. And it had 15 beds and all the expenses, salary for all the people and day-to-day expenses for running the hospital. Everything was given by the king. All the informations are given in that epigraph. Not only that, a list of 20 medicines which were used in that hospital were also there in the epigraph. But as I already told, because of the Sanskrit influence, the medicine names are in Sanskrit, that I should agree. But they are all Siddha medicines in practice. This is the small photo of the Tirumukural epigraph. We can see the compound wall of the whole temple. This is the longest epigraph. It's going on and on. And you can see some people are reading that epigraph. I think it's easily, quite clearly visible over there. And there are many epigraphs. I have consolidated that epigraph into 1 or 2 slides. A medical school which had 364 students were told in Thiruvavadure epigraph. And many other epigraphs in Kivagalur, Taramangalam, etc. Everything is in my paper in the book. It told about the hospitals, tax-free lands given for hospitals, tax-free lands given for the physicians, dispute about that land and a judgment about that land, and even government permission was needed to raise certain particular herbs, and that permission is told upon in one of these epigraphs. And in the Middle Age literature, Kambramayanam tells about the surgical procedures in Kumbhakarna Vadayapadalam, and Kulasekara Alvar compares devotees bhakti to a patient's love to a doctor. Valal Aruthu Chudinum, Marthuan Bal, Mila the Kadal, Noyal and Pol. And the sentence that compares the bhakti of a devotee to a love of a doctor, a love of a patient to a physician, despite he cuts and sutures the wound. And after that period, there are umpteen evidences which we not go into through. Right now, I go into the second part of my 4-point things. Siddha is a medicine with deep scientific basis. Siddha is a medicine with deep scientific basis. The basic Siddha medical texts have exact anatomy and physiology. This anatomy and physiology is not translated one from English or any other language. It has its own peculiar names. Its anatomy is separate. There are even mentions about a separate anatomy text, which we are still looking into, but we are yet to get it. The physiology, the Siddha physiology is special. It is separate. It is more present in the Varmam text rather than Siddha text. We are also trying to reconstruct that physiology into that. And we have large number of preventive medicine rules in Thereyer and other suttas. We have a separate pathology based on Vali, Pittam and Ayyam, not Vada, Pitta and Kapha, but Vali, Alal மற்றும் Ayyam. And we have also classified medicines. We have as much as 4,448 diseases, which has a complete classification. There is even a book released by Saraswati Mahal Library in Tanjavur, a book called 4,448 Diseases, which lists out all the diseases. You may go if you are interested into it. And we are also excellent in preparation of drugs. We have 32 internal medicine forms and 32 external medicine forms. Not just 32, we have some extra also, but for some reason Siddhas have put 32 and 32 together. And few of these medicine forms like Kattu, Kalangu, Gurukulika, these and some other forms are not present in anywhere and any other system of medicine. And among these medicines, we are quite clear about their activity. They have been, the shelf life of the medicines has been clearly told. A Kashayam or Kudinir will go for only 3 hours, whereas a Karpam, Chattu, Gurugulge will go on for years together, maybe even 500 to 1,000 years. We have this type of drugs. And more importantly, time taken for absorption. Pharmacodynamics, how a medicine is absorbed, how it is excreted, this is a comparatively newer phenomena even in modern medicine. It's not more than 100 years old. But Siddhartha medicine text, a Kashayam or Kudinir will be absorbed in 12 minutes, a Parpam will be absorbed in 84 minutes. This type of information is clearly in Siddha text itself. And the pillar of the Siddha medicine is the usage of metals and minerals. We are the biggest, we are the pioneers of the metals and minerals, and still we are the major users even today. Advantages, why we are having this? Because it's having the following advantages. They are excellent, they are giving excellent result even in small doses. A 5 to 10 milligram dose even work, whereas a herbal medicine will be needed for 5 to 10 grams. And good results for severe infections such as chronic diseases and autoimmune disorders, which do not usually respond well to herbal medicines. And we can use Rasavadam also in medicine. And yesterday somebody asked Dr. Bharati how safe they are. And I wish he is here, he can have the answer. We have many safety mechanisms in preparation level itself. We have Shuddhi. We clearly purify the raw drug, and the preparation is a many-step process in which all the remaining toxicity will go off. And we have quality control before the drug goes off. We have testing methods. We look at the color. We look at the ability to float the medicine into water. And we also check that particular medicine with some other raw drug. Suppose for a group of medicines called chunnams, we add it with the turmeric and we see whether it turns red or not. If it turns red or not, if it turns red, we will take the medicine. If it doesn't turn red, we will say the medicine is not yet complete and we will put into one more pudam. And waiting period is something unique which I have not seen anything else. A medicine is completed, the medicine is kept idle for a year or 2, and only then the medicine is used. Even after the completion of medicine, medicine is left alone for 1 year, so that the toxicity may go off or its efficacy may increase, whatever it may be. But this waiting period is not seen in any other medicine as far as I have concerned and cross-checked with experts of many fields. And even in administration, we prepare the medicines by classical detoxification methods like giving laxative or purgative or even sometimes fasting the patients. We give a very strict diet regimen when the medicine is given. We give a pathyam and we stick on to the exact duration of the course. We stick on to the exact duration, and sometimes even after the medicine is given for 10 days, we also give another 5 to 10 days of Marupathiyam, in which the patient should not take medicine, but he should stick on to the Pathiyam. And sometimes we give a drug holiday. Drug holiday is a newer concept in allopathy. It is given in digoxin, in the usage of digoxin. You give 5 days digoxin and give 2 days leave, and then 5 days digoxin, 2 days leave, gone. But this drug holiday has been in vogue in Siddha medicine for some time. And Siddha medicine is one important discovery I wish to announce at this level is Siddha medicine is pioneered the use of iron in anemia. Iron for anemia was used by Thomas Willis in 1675 AD in his book Pharmaceutic Rationale Volume 2. But Siddha medicine is using this for more than 1,000 years. Padartha Guna Sindhamani says about the deficiency in treatment in a special term called Nattamidal, which I will explain later. And we are a complete medical system. We are in prevention of diseases. We are in the management of diseases. And almost all branches of modern medicine, be it pediatrics, general medicine, surgery, ophthalmology, orthopedics, everything is in Siddha system also. There is a table in the book in your hands, page 195. You can have the modern terminologies in the left side. On the right side, we have the Siddha terminologies. And comparative reference books also there. You can cross-check if you want. And going to the last part of my paper, this is not a medical system for today. It is the medical system for the diseases of future. There are 3 new diseases which came for the past 10 or 20 years. But even though we are a 1,000-year-old system, we have answers for these systems also. I am taking just 3 diseases. HIV infection, we all know. We have no medicines for that in the modern medicine. But when we dwelled into the Siddha text, we had something called Pattamaram Polakam Vette Meham. That is a quotation in Yakobu Vaitya Sigamani. And going into the HIV infection by the Siddha principles, we came up with a regimen called RAN regimen. Rasagandhi Meligu, Amukra Churnam and Nellikkai Elagam. This combination was given either separately or along with antiretroviral therapy, which produced a significant result. The CD4 count, which is used as a benchmark for treating the HIV patients, it increased. And we also gave other Siddha medicines whenever needed, depending upon the symptoms. And many patients are kept alive even after 10 years of treatment. Full-blown HIV patients are kept alive more than 10 years. They are waiting some wonder medicine will come up in the future. And chikungunya epidemic started, the present epidemic started in 2007. We treated them with Nilavembu Kunnir. The arthritis, which is the key problem of chikungunya, reduced quickly, and sometimes we have observed this improvement even with just 1 dose of Nilavembu Kunnir. And dengue fever, which is also carried by the same carrier called Aedes aegypti like chikungunya, we gave Nilavembu Kunnir and papaya leaf juice, which will increase the number of the platelets. Large-scale campaign all over the Tamil Nadu has produced the reduction in the severe and hemorrhagic dengue patients. So, as a conclusion, we say Siddha medicine is the evolved Tamil medical system. Siddha medicine has a history of thousands of years. Siddha medicine has many unique formulations and treatment methods. Siddha medicine is a complete and independent medical system. It is not adaptation of any other medical system. Siddha medicine is not a regional manifestation of any other medical system. And promoting this medical system can be a vaccine for diseases which may come in the future, just like chikungunya or HIV infection or dengue. If any other disease come in the future, we may have some medicine in that order. So this is Siddha medicine is a treasure that is waiting to be explored, and this should be given the due importance. Should be given. When this precious system is given the due importance it deserves, it will further enhance the already improved medical and scientific greatness of India. Thank you.